How is cancer recurrence monitoring done for survivors? Imagine finishing treatment and feeling hopeful about the future. But to stay healthy and catch any signs of cancer coming back early, survivors need a careful plan. Monitoring for recurrence involves several steps that work together to keep an eye on health over time. First, regular checkups with healthcare providers are essential. During these visits, doctors review medical history, ask about new symptoms, and perform physical exams. For example, cervical cancer survivors might have pelvic exams regularly, while testicular cancer survivors focus on examining the testicles and nearby lymph nodes. Blood tests are also a key part of surveillance. They look for tumor markers that can signal recurrence. In testicular cancer, doctors measure substances like alpha-fetoprotein, beta-human chorionic gonadotropin, and lactate dehydrogenase periodically. These markers can rise if the cancer returns. For cervical cancer, routine Pap smears or testing for human papillomavirus help detect local recurrence or new lesions early. Other reproductive cancers may have specific blood tests based on their type. Imaging studies are crucial too. They help find recurrences that might not cause symptoms yet. Depending on the cancer, doctors might order ultrasounds, computed tomography scans, magnetic resonance imaging, or positron emission tomography scans. For testicular cancer survivors, periodic CORT scans of the abdomen and pelvis are common to check for lymph node involvement. If symptoms or physical exams suggest recurrence in cervical cancer survivors, pelvic MRI or CORT scans are often used. Surveillance is tailored to each person's risk. Doctors use data and risk models to decide how often and which tests are best. This personalized approach helps catch recurrences early while avoiding unnecessary tests. Advances in molecular testing are also promising. Researchers are exploring ways to detect circulating tumor DNA in the blood, which could identify minimal residual disease or early recurrence before symptoms appear. While this is more common in some cancers, it is still being studied for reproductive cancers. Patients are encouraged to be aware of new symptoms and report them promptly. Many recurrences are found because survivors notice changes or discomfort. Routine surveillance can sometimes detect cancer before symptoms develop, which can lead to better outcomes. However, the balance between early detection and the risks or costs of testing, like radiation exposure from scans, is important. In summary, monitoring for cancer recurrence involves a combination of regular physical exams, blood tests for tumor markers, imaging studies, and emerging molecular tools. These are all personalized based on individual risk factors. The goal is to detect any signs of returning cancer early, improve chances for successful treatment, and support long-term health. Survivors should work closely with their healthcare teams to develop a follow-up plan suited to their needs, and always report any new symptoms right away.